And as I'm going to present to you now on Optimising Wellbeing. When Jackie couldn't present due to ill health, Ellie asked me to present the wellbeing work, and I was going to do this morning, but I felt after John McDonald's presentation, I felt that was so moving and so humbling for me to stand up and talk about well-being when we saw what those people were going through in Haiti was not the appropriate time to do it. So that's why I did the debridement this morning and moved the well-being slot to the end of the day. So as Michael said, him and I were the co-chairs for this development of a document, an international consensus document on well-being. It started quite a while ago, February 2011, in the Wounds International Conference in South Africa. And then we got together with a group in May 2011 in Brussels, and these were people from all over the world. From America, John was part of that group, John McDonald, Wendy White from Australia, Christina Lindholm from Sweden. So it was a real group of people that were really concerned about patient well-being. And it was a bit like Keith was saying this morning, that we were a bit concerned that we were focusing on the wounds and on what was going on in the wound bed, but losing the bigger picture. And as Karen has said there, the bigger picture should be about the patient, not necessarily just the leg ulcer. So there's a group of like-minded people that have got together to really look at this issue of well-being and being well-being, bringing it back into patient care and giving it a real high priority within patient care settings. Alongside the great and the good getting together to discuss well-being and review the literature and see what's out there in relation to well-being, there was also at the same time a piece of work going on in the States. And this work was funded by industry. And what it was doing qualitative research, talking to patients with leg ulcers, with different types of wounds, to find out how it affected their well-being and what it really meant to them to have a wound. And they didn't sort of just pop in and do a questionnaire. They would go and spend a day and live with the patient to find out exactly what was going on. And I say this was over in America. So we had the literature feeding into the document. We had opinions of the great and the good, and then we also had this real world research. And alongside that as well, there was a group of patients in Bradford, and within Bradford the patient group there also sat with us and discussed what well-being meant to them. So it was one of those documents that was about patient well-being but was also very patient focused, not just our perception of their well-being and what we could do to enhance well-being. So the aims of the document are there on the slide for you to read. And I think we met our aims during the time. And as I say, the document has been produced and you can download it from the Wounds International webpage. So that's what we hope to achieve by getting together and having this wellbeing discussion and consensus meeting. So I thought, really, if I'm talking about well-being, perhaps we need to bring this back home. And I thought, well, what does well-being mean to you in this room? What enhances your well-being and what decreases your well-being? Yeah, air conditioning, Michael said. I think I could do the nice iced G&T. I think that would help mine at the moment as well. Does it mean the picture at the top, finding peace and tranquility and solace and somewhere where you can get away from the stresses of everyday life? Is that how you find well-being? Is it pottering in the garden and sitting there and reading and enjoying the peace and quiet and seeing your fruits of your labours? Or is it going to a beach party in Ibiza? Well, that wouldn't be for me, really. I think that would cause me more stress than anything, really. I have enough trouble with smart casual for the evening events at conference, let alone what you'd wear for a beach party in Ibiza. So again, well-being means different things to different people. It's not a permanent thing, it's a thing that's a relatively fluid concept. The first thing we had to do, and this sounds a bit daft really, but no one had defined well-being. So before we could say and address well-being, we had to actually define it. And it did take us a long time to come up with this definition, obviously that you can read for yourselves there. But we had to really try and encapsulate what well-being was and define it. And we felt that was a fairly good definition that would guide people to know what we were talking about when we were talking about well-being. And I'm getting a really beautiful, cool waft from behind me, so I hope it's getting towards yourselves there. It's beautiful. Okay, so there was our definition of well-being. When we looked at the concept of well-being, we had to look at how we measured success. And it's bit similar to what Karen was saying, really, because we needed to look at well-being from the position of the clinician, from the patient, from institutions, and from industry, because in tissue viability and wound care, we all work together. We all need each other to get the picture whole. So we needed to think about how we all actually measured well-being and measured success. And we felt that as clinicians, that's how we measured success. And that lady there was one of the first patients that I saw when I came into my tissue viability post. And I got great sense of well-being from seeing that lady's legs go from the large edematous sluffy legs to the beautiful granulating legs. So for me, that was a measure of my success. But had I actually improved the patient's well-being, or am I going back to what I was saying before, that I'm so focused on the leg ulcer that I'm not thinking of the wider issues for the patient? How does industry measure success? Is improving the well-being for industry, does that equate with their improvement in their sales figures? Their ability to get products to market? Is that how they measure success? And in wound care, that might be what they class as part of well-being, but really, is that what well-being's about? We don't know. But we felt that we were looking at things in different ways that perhaps weren't patient-focused. Karen spoke about this slightly within her presentation. How do healthcare institutions measure well-being? To them, would it be their prevalence rates, their leg ulcer healing rates? Would it be their complaint rates? But again, is that addressing patient well-being or just keeping their systems flowing? So we felt we needed to look at this within the document to see how we can look at institutions, improve the well-being of the staff and the patients in their care, and not just be sort of negative in their focus. And obviously, if you look at those columns, where I work in this Buttia Stradvawa, ours are the other way round. We have more people in the gratitude column and very few in the complaints and carefully. It's all right, isn't it, Jan? Okay. So then we said, right, how do clients measure well-being? And I think within leg clubs, you have got such a handle on this. I think because you see well-being before your very eyes, and you see well-being being perpetuated because you know that people come to you, they come back, and they keep coming, and they don't want to not come anymore, because by coming to leg clubs, their well-being is being enhanced. So I think in a sense you're way ahead than the rest of the field when it comes to identifying an environment where patients' well-being is paramount and is a very positive experience. And it's what Karen was talking about before with quality of life. And there is debate about whether is well-being quality of life or is it something different. And we think it's something slightly different than just quality of life. Within the document, we talk about the domains of well-being. And you can see the domains of well-being here. And Karen alluded to some of these as well, about what people want, what people expect from us, expect from the care they give. So we have these domains of well-being, and I'll just go into these in a slightly more detail now. We can measure and assess people's quality of life and well-being, and we have got certain specific quality of life tools. But I don't know if any of you have looked at some of these quality of life tools, but they're not easy to administer and they're not easy to complete. And we're not sure whether they actually encapsulate the totality of well-being or not. So if we can't assess it, sometimes we don't know if we're going to achieve it. For things like pain, we've got our visual analogue scales that help us assess if a patient is pain-free. But you might be pain-free, but does that mean that your well-being is paramount? We don't always know that. And people will sometimes tell us, and you do see it, don't you, in the leg clubs when people are discussing and sharing of experiences. They share, self-report how they're feeling. But also sometimes if you ask a person, how are you, how do you feel? We tend to say, yes, I'm fine, thank you, how are you? And that's where the dialogue about well-being sometimes stops and doesn't go any further. So sometimes as clinicians, we're not quite sure how to find out how someone is, how to tap into their well-being to see if we're addressing their needs or if they've got unmet needs there. And we can just watch, can't we, and see. And we see people who are stigmatised, people who have got a loss of confidence because they feel that the leg ulcer has reduced their self-esteem so much. We can see it by sometimes their verbal and non-verbal behaviours. So what the Wellbeing document did is it produced these trigger questions, and it only produced 5 trigger questions. And these questions came from the work with the patients from America and from the patient group from Bradford. And they felt that by having these 5 trigger questions, it enabled us as clinicians to start having the dialogue with someone about their well-being, so that we're incorporating well-being into our patient assessment by using these trigger questions. Because sometimes we'll ask about whether the dressing's leaked, whether the bandages slipping, how were things. So we're great about having that kind of dialogue, but sometimes we don't take it any further and talk about well-being. And when I was talking about this with a colleague the other day who works, unfortunately, he hasn't the luxury of working in a leg club. He works in a clinic in a hospital. And he said that he purposely doesn't use these kind of questions because he knows he's got to see someone in 10 minutes. And I know with working with Jan in the practice, we have 10 minutes to see someone. We haven't the time sometimes to always open this dialogue. So sometimes then what people do is they actually just don't enter into that dialogue, and the patient's well-being is never addressed. And we need to look at ways of doing that. Whereas I think in the leg club environment, you've got a marvellous environment for having this dialogue and debate and discussion and putting well-being really high on the priority and a key part of your patient assessment. I know that's one of Ellie's drivers at the moment, is to make sure that well-being comes to be part of the patient assessment in every leg club in the world. So I know that's a key driver for Ellie at the moment. When we think of well-being, sometimes we only think of the patient's well-being when they're actually with us in the leg clubs or in our clinical environment. But we looked within the document to say, well, how can well-being be affected throughout the 24-hour period? And you can see there that throughout the day, the leg ulcer could affect the patient's well-being in many different aspects. So whether it be the night pain, whether it be the edema building up during the day if we've got subtherapeutic compression, because patients can't tolerate the high levels of compression that's required. The pain, the interference in their life. We don't tend to pick up this 24-hour pattern. We only tend to pick up what's happening when the patient's with us. So we need to think of well-being as being something that carries on throughout the day and is not just present when we're with the patients. We need to be more cognizant of the wider issue. Excuse me. So these are those domains of well-being that were on that concentric circles before. Excuse me, Mark, I have to drink of water, please. So you can see we've got the physical domain and we've got the psychological domain there. Excuse me. Thank you. For a minute when you got up there, I thought you were going to give me the decanter to drink out of. Dear me. No, he wouldn't, he wouldn't. And these were what Karen echoed on her previous slides when we were talking about patients' quality of life. We're doing it in stereo, Roland. Then we have the other domains of well-being there. We have the social domains and the spiritual and cultural domains. And we try to build all those factors into those domains of well-being. So when we're assessing a well-being, we're not just thinking of one aspect, because sometimes it's easy to just focus on, say, just the social aspect and not remember the others. So we've tried to build in this whole picture of domains that look at all these different aspects of well-being. There are issues surrounding well-being, and that was alluded to earlier on in today when Keith was talking, that what we're trying to achieve for the patient might not be what they want. They might want something completely different from what we want. We might want to heal the leg ulcer, they might want just to have pain-free situation. So we really need to make sure we haven't got these conflicts of interest there. I've mentioned the time pressures and the professional blunting. And also, again, we need to make sure that a patient's well-being, and Karen discussed this, is them getting the services where they want them, when they want them, and services to suit themselves. And the Leg Club, again, is a marvellous example of this flexibility of service that patients can access. Steps to promote well-being that are suggested in the document, and patient empowerment was one, that the patient takes control, but Karen has discussed this with you already. And those things there are very important. And one of the complications, again, that people certainly don't want to have to deal with is infection. It really is a very frightening situation for a patient and very despondent when they get these recurring infections in their leg ulcers. So steps to promote well-being mean about dealing with all those issues on that slide. And there's guidance about how to do this in that document. So how can you get, well, clients, they're called in the document, but to yourselves, it's members. How can you optimise their well-being? And these are the things that the document discusses. That if we follow these and have these as our tenets, hopefully these will help us then to promote member well-being. And it's quite difficult, isn't it? And I think that one, helping to maintain a positive outlook, especially if you had your leg ulcer, it's been healed, it's stayed away, you've worn the hosiery, and back it comes. It's really difficult sometimes to help to keep people positive, but keeping a positive attitude really will help their well-being, because there's nothing worse when you feel you've lost hope and there's nothing there for you. These are other ones there. When I was going through these, I thought, which ones shall I put in bold? And at the end, I thought there was really, perhaps they all should have been in bold, because they were all really important when we're dealing with our clients. But just by doing those things, talking about well-being, incorporating it into your assessment, making it part of the language you use as a clinician when you're talking to members, can really start to get well-being on the agenda and have it part of our dialogue and assessment process, that patient gets used to it. So I would imagine if I went in to see my GP and he suddenly said to me, you know, how's your well-being? I think I'd be slightly concerned that he might have lost the plot, because that's not part of the way we necessarily have those dialogue or conversations currently with our healthcare professionals, but we need to start bringing that in to our everyday conversation, the terminology and the language that we use. There's a 5-point plan for clinicians. There's also a 5-point plan for industry, a 5-point plan for organisations. So there's a 5-point plan for everybody to work together to promote well-being. And this is a 5-point plan for clinicians. And again, I think these things have come through lots of the presentations today about giving patients choice and keeping patients at our focus. But again, I think in the leg clubs, that's the way you've always worked. So you're well ahead of the game. For the patients, it's what they can expect. And this is a bit like a charter for them to know that we're going to look after their well-being, and we're going to make sure that they're at the centre of what we do. And again, I think that's already built into your philosophy. But for an awful lot of people, that isn't there, and they need to be told what they need to bring in for the philosophy for patients to be able to access and receive what's on the slide here. That's for the organisations, and perhaps again, with your leg club model, you don't really need to address this, but an awful lot of organisations do need to make sure that this is in place, to make sure that the staff well-being is in order and the staff well-being is a priority, because it applies to all of us, doesn't it? We've all got to have a safe and stress-free environment to work in and function in. And industry as well, they still have a role to play. And we're looking at here, aren't we, at ethical sales and marketing and research to produce products that actually enhance the well-being of members and clients. Because if they don't help us from that perspective, we're never going to deal with some of the symptoms that really make a patient's well-being important, such as exudate management, pain-free dressings, etc., etc.